It's my pleasure to be here with you this afternoon to speak about housing and the interconnection between housing, home, health, but also food. So what I want to do this afternoon is to speak to you about what I know about the interconnection between housing, health, and food. And this is drawing on research on energy insecurity or energy poverty, a situation that happens when people cannot access or afford the energy services that they need to maintain healthy indoor temperature and to live with dignity. So through research on energy poverty in southern Quebec and also in Nova Scotia, the heat or eat dilemma becomes very quickly apparent. And I want to tell you a little bit about that this afternoon. I also want to draw on research that I've been conducting in collaboration with Inuit communities in Northern Canada. So the Inuit are one of 3 Indigenous peoples in Canada. So I want to speak about the interconnection between housing, home, and health. And we'll close on thinking about housing as an ecosystem. The WHO recognizes housing as a fundamental determinant of health. According to their housing and health guidelines, healthy housing is shelter that supports a state of complete physical, mental, and social well-being, is structurally sound. It provides shelter from the elements. It provides sufficient space, comfortable temperature, adequate sanitation, safe fuel or connection to electricity, protection from pollutants and other nuisance. Healthy housing provides a feeling of home. So housing is not just about 4 walls and a roof. It's about providing this sense of home, this sense of belonging, of security, and of privacy. Healthy housing relies on the immediate environment and the extent to which this provides access to the services, to resources that are necessary for people to lead healthy lives. It also depends on the local community, which enables social interactions that support health and well-being. So this is one conceptual framework to understand how housing and health are interconnected, but there's been many frameworks that have been published over the years to highlight how the different dimensions of housing are influencing health through different pathways. Swope and Hernandez published their Housing and Health Equity Framework in 2019 in Social Science and Medicine, and they emphasize 4 dimensions of housing that are important for health: cost, condition, consistency, and context. And through some of our research in the South and in the North, we've added 2 other dimensions: constancy, so this idea of sense of home and ontological security, and then the importance of care and connection that takes place inside the home. So I'm going to go over these different dimensions, but you can think for yourself what these means in the places where you're from, where you live, where you work, what might be missing, and it would be great to discuss that in the question period. So when we think about the cost of housing, here we think about how much is rent, how much people have to pay for their mortgage, how much do they spend to access the energy services at home that they need to cook, to prepare food, to store food, for example. What are the conditions of the dwelling? What is it made of? Is it structurally sound? What are the water and hygiene facilities that are present? Is it overcrowded or not? Again, what is the energy system? What type of fuel do people use to cook? Is it electricity? Is it gas? Is it biomass? Consistency refers to having a constant dwelling. So not having a constant dwelling would be being in a situation of homelessness. But consistency is about housing insecurity, not owning the land, not owning the house where people live, the limited option and obstacles to finding housing, the risk of being evicted, of being removed from one's place of living. Homelessness falls into that, as I mentioned. Then there's the context of the home. So the local, the social, the built, the natural environment, the policies that are put into place, the practices around housing that are allowed or are discouraged. Then there's this idea of constancy, this ontological security, feeling safe in one's home, feeling safe in a base from which people can carry on their daily routines, having a base that provides a sense of safety, of security, where one can raise their family. And then care and connection refers to giving or receiving care, the social relationships, the social dynamics, the power dynamics within households or between household members and landlords, for example. All these different dimensions of housing are important for health. They're also important for food security. And I want to highlight 3 of these dimensions and how they can be related to food, focusing on cost, on conditions, and on constancy. In Canada, housing costs have been increasing very quickly since the pandemic. It started before the pandemic, but the pandemic accelerated housing cost. So in Canada, we define a housing or a dwelling to be unaffordable if the household need to spend more than 30% of their annual income on shelter-related cost. So shelter-related cost, it's rent, mortgage, property taxes, energy services. So in Canada, it's 1 in 5 households that are living in unaffordable housing. Among renters, it's 1/3. So 1/3 of renters are living in a dwelling that they cannot afford. And it's about 15% of homeowners that are living in unaffordable housing in Canada. About 15% of Canadians said that in the past year, because of the price of their energy bills, they had to forego expenses for basic needs such as food and medication for at least 1 month. It's about 20% lower income households that have to cut on food or medication to pay their utility bills. 27% of lone parent family had to forego basic needs to afford their energy bills. So this relates to the heat or eat trade-off, which was first coined in the early 2000s by Batakarian colleagues. They published a study in American Journal of Public Health where they wanted to look at how lower and higher income families fared during cold shocks, how families, were able to spend on fuel for heating and spending on food. And they saw that during cold shocks, both lower income and higher income families increased their spending on food. Higher income families also increased their spending, during cold shocks, both type of families increased their spending on fuel. Higher income families increased their spending on food. But lower income families decreased their spending on food to the same extent that they were that they increase their spending on fuel. So we haven't been able to look at exactly this trade-off in Canada. There's studies that have showed in the past that the increase in energy prices are associated with food insecurity, and that households who are food insecure will tend to spend less on energy services compared to households that are not food insecure. In 2022, we conducted a study in Bridgewater. It's a small town of 8,000 people in Nova Scotia, a province in eastern Canada. And in this study, we're working with the town to document housing needs and energy needs before the town deployed a large program aiming to reduce energy poverty. And we asked people in the past year, did you have to cut back on food to pay your energy bills? Or did you have to cut back on paying energy bills in order to put food on the table? And about 34% said that they engage in either or. So 34% of respondents, over 500 people participated to the survey, said that they resorted to the heat or eat trade-off. This was higher among women, young adults, those with lower education and lower income, and those living in dwellings requiring major repairs. We also conducted in-depth interviews with people facing energy poverty, both in Nova Scotia and in Montreal and on the South Shore region. And these are some of the stories that were shared with us. I pay my rent, my electricity, then food. I want my electricity bills to be as low as possible. It's my number 2 priority right after housing. Food comes after that. Eat healthy? You can't eat healthy. Not anymore. This older gentleman said, well, I'm a senior. I live on fixed income. Everything, housing, energy bills are just so expensive that sometimes you just go a day or two without eating. Right? And then this last quote is taken from a service provider in Quebec that was explaining when households get disconnected from energy services, all the food that they've been accumulating over months in their freezer just go bad very quickly. Right? So dramatic impact of housing cost and energy cost on food security in Canada. Another example, this time going further north, across Inuit Nunangat, the 4 Inuit regions in northern Canada. Housing has been in a state of crisis since permanent settlement started a long time ago. So here you have 2 statements from a report that was published in 2011 to say that housing, rather than being the safe haven and source of security that it is for most Canadian, is clearly one of the biggest barriers to health and to well-being for Inuit, as well as a significant challenge to economic and social development. Housing is not the only issue, but all issues relate to housing. So this graph shows the prevalence of substandard housing condition across the 4 Inuit region, as well as the prevalence of food insecurity, as measured in 2017 in the Aboriginal People Survey, which used a modified version of the Household Food Security module. So if you go to Nunavut, for example, the largest territory here in blue, it's 60% of the population that lives in overcrowded condition. If you look at food insecurity in Nunavut, it's, almost 80% of the population that is food insecure. So these numbers are really high compared to national average of 10% overcrowding, for Canada as a whole, and about in 2017, around 14% of households facing energy poverty, food insecurity. A previous study we conducted with colleagues at Laval University using data from the Nunavik Child Development Study showed that cutting down on the size of children's meal, which is a very sensitive measure of food insecurity, right? If you start cutting on the size of meals for kids, something is really, really wrong. So cutting down the size of children's meal was twice as high in overcrowded dwellings compared to dwellings that were not overcrowded. And a few years later, through a study we conducted in Nunavik and Nunavut to look at the impact of social housing construction. So if we build more houses, what are going to be the impact on health and well-being for people that will have the opportunity to relocate. So we conducted interviews. These are taken from a paper that Karine Perrault, a former PhD student here at the School of Public Health, that's part of her thesis. So she was asking different questions around sense of home and ontological security and having enough space in one's home, or having to negotiate living with too many people. So this respondent said, well, I tried to buy food for my family and tried to cook enough for my family and for my kids, but sometimes it's kind of hard to feed them. There are too many people in my house. We mostly ran out of food, drinks. Sometimes my kid don't eat for days. So in Inuit culture, sharing food is very prevalent. So through the discussion that Karine was having with some of the participants, this moral dilemma of having to share a limited amount of food with others was something that was really difficult for people to negotiate with. Some people said that sometimes they would go in their room, they would lock the door, and they would eat away from others. That they would eat out at a restaurant in a community where there was a restaurant because they wouldn't have to share food. So another examples of how this, this ontological security of being well in one's home and to be able to eat in one's home is compromised when there are too many people inside the home. So this brings me to, looking at home and housing a little differently than the way that it has been looked at least in Canadian policies and research. This beautiful illustration is from Mila Nakeko. She's a Dene artist from the Northwest Territories. And we organized a workshop last May in Yellowknife, the capital of the Northwest Territories, to understand what housing means to Northern Indigenous people and community organization providing housing support. And we started to ask the question, what is housing important for in your community? And we started this discussion by reflecting on, what housing means and what health means. And health conceptualization in Indigenous culture is relational. It's about being well with others in space or in place, right? So it's the relation with others, it's the relation with place, it's relation with ancestors. So you see here, when we ask people, what is housing important for you in your day-to-day life, in your community, you have housing being, important for culture and ways of life. It's about the home as a place to transfer knowledge about food, about traditional ways of being and doing. Housing is about governance and self-determination, being able to take, own decision about the land, about the home and the housing environment. It's about supporting children and family across the life course. It's about health and well-being. It's about community strength and development. It's also about education. So housing enables all of this in Northern Canada through this workshop that we conducted in the Northwest Territories. It might look different in other regions, but this is what came out of the discussion. And this idea of relationship, right? Remember, not all issues relate to housing, but housing relates to all issues. Something else that we're trying to do within At Home in the North, and At Home in the North is a pan-Canadian housing partnership on northern housing that was funded as part of the National Housing Strategy. It's a partnership that's funded by Social Sciences and Research Council of Canada and Canadian Mortgage and Housing Corporation, which changed its name. It's too long. But one thing that we're trying to do in A Home in the North is to challenge the idea that housing is a continuum. So Canada Mortgage and Housing Corporation, that oversees housing regulation in the country, CMHC, they work with a continuum. And on one end of the continuum, maybe on this end for you, it's homelessness, all the way to homeownership, right? So people graduate, over this continuum during their housing journeys. But for no one, or maybe for some people, but not from everyone, the housing trajectory is not linear. So that's what we're trying to challenge with At Home in the North. Trying to understand, okay, well, what do we need to create a home that is healthy, a home or a housing system where people, communities, Indigenous government feel they have agency. And it's starting to look like that, starting with the land, starting with the buffalo, starting with country food. So home is land, and it all starts from that. And health is land as well. So if you go, I'm not going to read everything that's on this beautiful image, but really the housing ecosystem is foregrounded on land, is Indigenous-led, is community-based, and it's recognizing that the needs of people in any community with respect to housing is multi-layered, and it is complex. So I want to leave you with that image, just because maybe this is something that we can work from together to see how this conception of housing, home, land, food, and health is connected to your own realities. I have a few more slides. One is just to say that WHO, and I started this talk to say that housing is a fundamental determinant of health, but it's much more than that. It's a human right, but it's also a prerequisite for health. So I still remember my definition of health promotion when I did my PhD here. Well, it wasn't here when I finished my PhD, but there's so many things that are required for people to be able to achieve health, shelter, peace, safe and healthy environment and foods, among others, right? So yes, we talk about housing as a fundamental determinant of health, but it's much more than that. All right, so I think I've gone under time. So happy to, yeah. Hello.
Okay, we're good. Thank you for an excellent presentation. The choice of Bridgewater, Nova Scotia. What's the story around that?
Bridgewater in 2019 won the $5 million from the Smart City Challenge plan to implement an energy poverty reduction program. So there's two ways that I can answer that question, how I ended up working in Bridgewater on that. But it's, it started for a discussion around housing and equity and how winners of the Smart City Challenge looked at health and equity. And in Atlantic Canada, it's about 30% of the population that are energy insecure. And Bridgewater was really at the forefront of the fight against energy poverty in the country, and they really wanted to tackle the energy poverty crisis head on. So they bid for the Smart City Challenge, and I just happened to be there for another project and realized that energy poverty is a huge issue in Canada that we don't talk about at all.
Very interesting, thank you. And since I'm holding the mic, I'll ask a follow-up. I hope that's okay. smart cities, they're usually very like techno-centric
Yep.
conversations.
Yep.
Were food systems, was that part of the conversation?
Yes, no, definitely. So so Energize Bridgewater is the program that's implemented in Bridgewater. So it was a multi-pronged program. The one that I'm involved in is around housing. So there's home energy upgrades at no cost or low cost to lower income households. But then there's also an energy monitoring systems around energy use inside the house that is being implemented. It was just launched a couple of weeks ago. So yes, there's that element of smart city and technology and embedding technology in evaluation.
Got it. Thank you.
Thank you for such a wonderful and enlightening presentation about some issues I honestly wasn't aware about here in Canada. I'm Julia. I'm from Bishop's University. I work with Vivian Valencia. And I was wondering where in this continuum of housing that you use at home in the north, would you place this idea of housing land trusts? Have you heard of the idea of, okay.
That's a good question. I don't know on the continuum. I wouldn't place it there because it's kind of, so it's not just about housing. It's about how we acquire land and turn land into, a collective good and make housing that is affordable, that is community. So we're talking about community housing as well. It's not market-based housing. So I would, on the continuum, so you have, I should have put the slide, but so you have homelessness, and then you have all these community supportive housing, shelters, and then you have, lower income affordable housing, you've got community housing, and then you get into the private market. So I would put it somewhere here, if it's clear, on this continuum. But the idea of looking at the continuum also is to challenge this idea that you go from homelessness to market-based homeownership as, the culmination of what a housing trajectory should be, right? If you turn to other countries like Austria and Vienna, where many, many people live in social housing, and where social housing is in really great shape, it looks good, it's efficient from an energy perspective, right? So we need to change how we view housing, but it's also to recognize that someone who's a homeowner, something, might happen in their life where they become sick, they lose their job, they're no longer able to pay their mortgage, and then they become homeless, right? So they go from one end directly to the other, not going across the other housing supportive systems, right? So it's, yeah. Sorry, I'm not sure if I'm answering.
Yeah, no, and if you were defining or how would you reflect on this land trust without thinking about the continuum? Like, because you were saying like maybe if we think about the continuum I mentioned, it's a bit tough, I will place it here. But if you were thinking without framing it in the continuum, what will be your reflections?
That we need to think about housing differently, and that is one good example that could take us a long way in trying to address the housing crisis. If you go to BC, for example, to British Columbia, First Nations are, building high rises on their land, making affordable housing, right? So there's so many different stories that we can learn from across the country and from across the world on how we deliver housing. So land trust is one way to do it, but there are several others.
Merci beaucoup, Mylène. C'était génial. I have an example to share, and then a question that's based on that example. We finished working in a community in Saskatchewan where we do a dietary survey. We ask questions about food environments, etc. But we also have a component of the study that looks into indoor air quality, which looks at molds, things like that. And we were surprised to see that mold was very high, indoor pollution was very high in those houses. And then we have an advisory circle in every community we work in, and so we're asking them what's wrong. Are these houses old? And they said these houses were built 3 years ago or something like that. And the problem is the federal government built these houses in a swamp in the community. And so how all this work and can lead to this still happening in Canada in the 2020s, and what's wrong, except, other than racism? What is it that's causing this to continue to happen in communities where, if you have housing, it's bad quality. You have bad quality of vinyl flooring that leads to contaminants being more present in those houses than in our houses in the city. And these examples that are unbelievable, but still are happening. So I want to, since you have been working on this issue more than we ever did, but we're confronted with this because this is having an impact on people's health that is related to their diet. Just to give an example, if you are anemic, then you are more prone to poisoning with certain metals, for example. So the link is there, and if you have a polluted house, then this is part of the problem. So why, basically?
I will answer that question with another example. In 2014, I was part of a design charrette in one community in Nunavik, where about 12 people from different communities from across Nunavik got together with architects, engineers to design a house that would be more in line with how Inuit wants to, live inside their house. And a lot of cultural preferences is around food and having enough space to prepare and to eat food with large family. So long consultation that went over several months. The house was designed and it cost way more than what this cookie cutting approach to housing construction is, that the Inuit owned company and government say we will never do this again because it's too expensive. So this comes in to the question that Paulo asked about lock-in and path dependency. That's the way I understood it. So probably what happened in that community in Saskatchewan, that's where it was cheapest and most cost effective to build. Same reason why we're still building in floodplains, right, in elsewhere in the country. So it's really the cost, and it's not about, how long it's going to last. And when I challenge people working at the Nunavik government to say, okay, well, yes, you build one, of course it's going to be more expensive, but look at the impacts and if you build more of that design over time, it's going to be more cost efficient. But they said, no, we have limited amount of money. We need to house so many people. So we're going to cut the cost. But then there's, Nunavut has procurement is a huge issue. I don't want to get too deep into procurement in the construction industry in Canada, but Nunavut completely started back from a clean slate, and they told all their, procurement, suppliers, thank you. They just said, okay, we're done doing with you. We're starting from scratch. And they were able to reduce housing construction costs by about half. And now they're able to build more. So path dependence is really, really rigid. And yeah, that's probably what explains what you saw in Saskatchewan.
I have a question.
Oui.
So these are very interesting examples that both of you gave. What's the commonality? What can we learn from those examples? My question is, how do you qualify the support that this government is giving to the situation? Are you satisfied? Are those examples like bad apples, or is there something more systemic and more darker about our system. So can we go there if we wish? I want to understand why these things are happening. I don't know well this country that we name Canada, but from outside, it sounds like there's maybe a problem underlying these examples.
Housing has never been a priority in the country. If you think, in the 1990s, Canada Mortgage and Housing Corporation completely cut funding for social housing. So there was a few decades where there was very little social affordable housing being built across the country. So now, with the National Housing Strategy that was launched in 2017, it was the first time ever that Canada had a housing strategy. So we're talking like 8 years ago. Housing has never been a priority. It was always the private market. It was always driven by market. And market is driving, decision made around, well, do we build in a swamp because it's cheaper? Do we build in the floodplains? So yeah, the system is flawed, but I don't want to get lost in conjecture, but there's, different commonalities here. And if, this idea that social housing has to be bad, then we have to cut on cost because, some people who live in social housing, it doesn't matter to them, if they live in an apartment that is beautiful, right? It's crazy that, we have these discussions, but I mean, it's anecdotal, but what I can say is Canada has been underinvesting in housing. The housing crisis has been a crisis since communities started to be settled in, 30s, 40s, and 50s. Still living memory that some communities were forced to settle. So yeah, I don't know if other wants to chip in, but yes.
I'd like to go to another group. I do work with migrant farm workers, and you may have seen pictures of some of the housing that is provided to migrant farm workers. In particular, we're focusing with climate change on the increase in night heat, like up to 36 degrees, that kind of thing. So in your circle, and they're providing food and trying to work and all those kind of things. So how, where, money is important, but how are there programs, or can you conceive of programs that could somehow support people who are kind of employer dependent? The other groups would be construction crews, firefighting crews, etc. For the quality of housing that, that they've got space to actually cook. They've got enough fridge space for all the migrant workers to actually be able to put their food so it doesn't go bad and they end up with food poisoning, etc. Any thoughts on this dilemma? Since you're...
Well, there's so many ways to start answering that, probably not very convincingly. But, this idea that housing is a human right and that Canada recognized housing as a human right, I think this is a door that policymakers and researchers and community organizations could make a much better use of. So when there's human rights violation because of inadequate housing that is provided for farm workers, sorry, I'm losing my words. Citizens of other countries coming here temporarily or for longer term to work, right? I went back to the WHO Housing and Healthy Guidelines. There's 5 recommendations around 2 around temperature, lowest temperature. So a temperature inside the house shouldn't go below 18 degrees. There's still no recommendation for higher temperature, but it's, there seems to be consensus around 25 degrees. So providing air conditioning, could be, something to be argued around. There's a recommendation around overcrowding. There's different threshold or different ways of measuring Overcrowding could be more than one person per room, more than 2% per bedroom. Then there's a Canada National Occupancy Standard, which probably doesn't apply to your population. So there's, and then the other two are around structural integrity of the dwelling, around falls and injuries. Like injuries is the number one, direct physical impact of living in substandard housing. Heat stress is there as well. And the fifth one escapes me, but maybe these would be like working on these 5 recommendations and just, there's human right violations that are clearly apparent. Merci.